I know what Botox is, as I'm sure most people do, but what is Softox?
Softox is actually just something invented to explain to people that you have a different way and a softer way of doing it. But for me, I use different toxins, I use different areas, I use specific, I use spread out, I do softer, I do hardcore. There's not one black or white of it, it just is what suits you. I may have a young patient who barely needs anything and just dips their toe in and it's preventative, it's to lift, and then I may have an older one where it's difficult to put a lot in because their muscles have set in a certain way and you could risk certain ways of brow falling, dropping, and then you've got maybe someone who really doesn't want to move anything. And I guess it was just invented to kind of make it a mystery, but it really isn't.
And I guess that's interesting because when I first heard of Botox, I just thought, well, Botox is Botox, so it's just the same thing for everybody. But as you're saying, you know, depending on your objective, whether you want just a few lines softened, whether you want a completely smooth forehead, whether you're perhaps a little nervous,
well,
you can accommodate those things.
It's not so much about the lines. It's actually about the lift and how it makes your eyes open up and you feel your whole upper face is lifted, and how the muscles work in between them. I don't care so much about the wrinkles. The wrinkles I'll sort out with the skin and the biostimulators more so.
Yeah, so that's interesting because I always thought Botox equals you get rid of the wrinkles, you get a smooth forehead, but it's actually significantly more complicated than that.
Yeah, I can give you a better expression if you like. You could look angry, but you could look sad, or you could look tired, or anything, and we can change that also with the fillers.
Wow.